Hi, I'm Maddie.
And I'm Taylor.
And we are fourth year pharmacy students on a 6-week placement here in Karratha.
So when the opportunity came up for us to go to Karratha, we thought that it would be a really great opportunity for some adventure.
I was originally meant to be going to Margaret River, and the opportunity came up to go to Karratha instead. I was a little bit hesitant, but we ended up here and absolutely no regrets.
So before we came to Karratha, both Maddie and I had had years of experience working in community pharmacies back in Perth. And so we were a little bit hesitant to think that, what were we going to learn that we didn't already kind of know? But, we were completely shocked at the amount that we actually learned while we were here.
We were involved in all aspects of pharmacy. It wasn't just standing behind a counter dispensing prescriptions. The focus here in Karratha especially is that pharmacists should have more interaction with patients. We really appreciated that and learned from that, so we spent a lot of time counselling patients on prescription medicines, on even just cold and flu medicines, just to make sure they were getting the best possible care.
One of the biggest things we noticed when we got up here as well is that there is so much pressure on the health system up here, and doctors are flat out all the time, and so the role of the pharmacists in the community was actually really, really huge. And a lot of people would go to their pharmacist for advice often before they would even go to their doctor. So we found that the respect and all of the information that we were providing to the patients was really, really valuable. So it gave us a sense of achievement that we were actually helping people in the community.
Yeah, we were definitely able to help, and it was really rewarding. The other thing I was going to say is the staff that we worked with were absolutely incredible. Not only our preceptors, who were an amazing source of information, so valuable, but we were just both welcomed into the setting just tenfold. Everyone was so helpful, so nice, and we fitted in really easily, so that made the experience of being here just that much better as well, because there's so much patient interaction as well as interaction with doctors, families,
other health professionals, optometrists, physios, everyone.
So we both spent 4 weeks in the community pharmacies here in Karratha, and then we spent the other 2 weeks at the Nickel Bay Hospital here as well.
So we'd been lucky enough to have experience in the tertiary hospitals back in Perth, and so to come to such a small hospital in Karratha was a really, really life-changing experience.
A massive eye-opener.
Yeah.
We spent time with the pharmacist who's in charge of all things pharmacy related. We also had a lot of interaction with doctors, nurses. We went on ward rounds with all the staff at the hospital, and we got to do lots of interacting with patients as well, which is so important to pharmacy.
I think one of the biggest things we noticed about being up here is how much they are reliant on the input of a pharmacist on the ward, because you get so many doctors and the turnover is quite high, being a lot of FIFO doctors. Having a pharmacist there who knows how things run is really, really important, and it really just added so much, I don't know what the word is.
It was just so different to the tertiary hospitals we'd been to, because the responsibility was more on us, and it was just, a really amazing learning experience. We've learned so much while we've been here.
So when we first told people that we were heading up to Karratha, their first response was, what are you going to do in Karratha? And since we've been here, we have been non-stop.
Never a dull moment.
We have not nearly had enough time to see everything that there is to offer. So we've been to places like Cossack, Settlers Beach, Point Sampson, Python Pool. There's just so much to see, and we haven't even touched the side. So it's also a really social town. There's always something going on. We've had orchestras.
There's been comedy festivals. There was a nitro circus here one weekend. There's also just so many places to sit and have coffee with friends. We've met so many people while we've been here at the community pharmacies and the hospital as well. And we've met lots of people through the accommodation as well, which has been awesome and made us feel a bit less isolated as well. So as I mentioned, I wasn't 100% set on coming to Karratha. I've lived at home all my life and haven't ever been away from home before, and I haven't done much travelling either. So coming somewhere like this was a massive step for me. Having someone like Taylor come with me was really helpful, but also just the environment that we've been in. We've met so many incredible people who have made us feel so welcome. Karratha is a beautiful, beautiful place, and I would 100% recommend it to anyone who's not really sure if they wanted to do it or not. The learning experience has been absolutely incredible, and it's just been so rewarding being able to go out and explore on the weekends as well. So glad I made the decision to come here to Karratha.
I'd really love to thank the WA Centre for Rural Health for providing us with this opportunity and for all the help that they've given us in our time here. I'd really encourage you all to take that chance, come to the Pilbara and see Karratha, because it's an experience you won't regret.